Good morning, good afternoon, good evening. Thank you for joining me at this point. I say classification based on the functional approach or functional model are those classificational methods that concentrate on the functions of those particular drugs used in psychiatry. I remember I've mentioned earlier that these drugs are working against its name. Against the drugs, against the condition that elicit its use. For instance, of these drugs, we have example of them include the following: like we have antipsychotic or tranquilizers, we have antidepressants, we have anticholinergic or antiparkinsonics, and we have the anticonvulsants. Then the under antidepressants, we have different subtypes of antidepressants which I will mention earlier, but let me concentrate on antipsychotic. The antipsychotic or antipsychotic are basically those drugs that are used in treatment of psychosis. So example of these antipsychosis are Cipizode, risperidone, olanzapine, Hador. You can still mention things like stelazine. But for better understanding, the antipsychotics is further divided into two: the major and minor antipsychotic. The minor antipsychotic are basically just like anti-anxiety medication. Because some people will ask, where did the anti-anxiety fall? Well, that's supposed to be the fifth classification. But for better understanding, remember that anti-anxieties are minor tranquilizers, and they do not, sedate the individual. Rather, they place the individual and relaxes they place the individual to be calm and relaxes the individual muscles. But overdose of it can also be classified as can also be known as hypnosis or hypnotic drugs. So overuse of anti-anxiety drugs can induce an individual into hypnosis. Then it becomes a classification of drugs. So most of the hypnotic medication are the one that have a higher dose of the minor tranquilizers. So we have the major tranquilizers which are being discussed earlier, like Cipizode, the haloperidol, the olanzapines, the risperidols. But now these major tranquilizers have further classification below it, where we have the typical and atypical, or classical and atypical psychotic, or old generation and new generation antipsychotic. The new generation antipsychotic are basically those antipsychotic medication that have been produced in order to, you know, reduce the cost, as well prevent some damages or extrapyramidal side effect or adverse effect of the old generational drugs. So they are basically produced for one, modification purpose, and as well as produced for enhancement purpose, and also to reduce excessive intake of substances. And they also have that long-term effect, and the quality is high, so also the price also high. So sometimes when you want to administer any of antipsychotic, you also consider the class of an individual. I'm talking about the economic class. If the person is in the class that cannot produce that drugs, that the family of the individual is in class that cannot produce that drugs, let me call the atypical side of it, can give the individual the classical or the old generational drugs. And when you're giving the old generational drugs, make sure you add those bipyridine subtype of it, which is basically called the athenes. For this case, it will prevent that individual from having extrapyramidal effect alongside. So, but if you're treating somebody at home, as for home psychiatric service personnel, make sure you give the individual drug that it will not, cause some adverse effect to that individual, because For the fact that the individual is taking the drugs in your absence, the ability to control the side effect becomes another challenge. So for that cause, you give the drugs to individuals that are in between or within your facility where you're practicing, either in your rehabilitation center or your psychiatric home. So for this, it will help the individual to be very, very what? Observe, and if there is any adverse effect, you can easily attend to the individual fastly or easily or immediately. Where that other one can also be given where you are placing the individual on what we call a parole or trial leave. So in the course of this, you give the individual alongside with some anticholinergic medication like attain. So this will help the individual not to develop extrapyramidal side effect while at home. But I know the atypical antipsychotic it is not necessary that it stop extrapyramidal side effect, but it reduces the extrapyramidal side effects. Note this, because of experiences in the clinic area, I was able to understand that the long time use of some atypical antipsychotic can also induce some extrapyramidal side effect, but is in a mild form. So the extrapyramidal side effect will not be as acute or as severe than that of the old generation antipsychotic or classical antipsychotic. So the purpose of this medication is to reduce long time admission because it has some effect, also reduce some of the side effects, which I will also discuss later. So for the purpose of those that is in the midwifery department, midwifery aspect or gynecological aspect of medicine or midwifery aspect of nursing, I want to advise you that for those that are pregnant and breastfeeding mothers, please, what should be given to them should always be monitored, because some drugs pass through the placenta blood barrier, and most of these drugs that have this efficacy of passing this placenta blood barrier are majorly the atypical antipsychotic. For instance, risperidone, clozapine, olanzapine, and aripiprazole, they can easily pass into that particular placenta blood barrier. Hence, the baby in the womb, in utero, can take it, which can now affect the developmental process of the baby. Even the brain development of the baby will be affected, and when that is affected, that is where you can have, if it's taken when the cell is forming, there is possibility of affecting some of the genes and some of the, let me call it, the chromosomes. And when a particular chromosome is affected in the nucleus, you see that to now lead to things they call the genetic mutation, leading to chromosomal anomaly, condition like Klinefelter syndrome, Down syndrome can also manifest in that individual, or Mongolism can also manifest. So it is advisable to taper when you realize that the individual is pregnant or have taken in. Tapering, I mean reducing, and you switch over to the classical antipsychotic in a lower dose as well. Even those that have parapsychosis, endeavor that you give these drugs that are classical, that is the old generational than that of the new generation, because they can also pass through the baby via breastfeeding, and if the baby take it through breastfeeding, it can lead to dental caries, can also distort the developmental process of the baby, even the brain development of the baby. Remember that the development of brain ends at age 25. So giving most of the antipsychotic to adolescents might also become a blunder in clinical psychiatry, because adolescents that the brain is still developing, you now give antipsychotic, remember that can also have that effect of damaging the brain of that developing baby or developing child. So I really want to, in a video, I will make a fresh video which may not criticize the use of drug in psychiatry, but we prefer the use of psychological method, which is non-somatic method, because why I bring this to gesticulate or to try to explain and discuss the best uses. Is it the physiological method, which is drug use, or let me call, or the use of physical method, the somatic method, or the non-somatic method? We have to choose between them. Are we going to apply psychological method than psychiatric method? The term psychiatric, it becomes a problem in psychology, because psychology is the father department, where psychiatry is a sub classification of psychology known as abnormal psychology. Then the abnormal psychology is trying to tell you that there is abnormality in the psychological state of that individual. That where psychiatry setting. So that psychiatry come into play. And now the best way to manage those psychiatric conditions is use of drugs. But now we hardly see some clear psychiatric conditions. What we have mostly now is psychological condition, which can also be treated psychologically. So at this juncture, I want to end this note so that some persons will not, misinterpret or misunderstand my area or my point of reasoning. But all I'm trying to emphasize is, make sure you meet a right psychiatrist, either a nurse or a doctor, or you meet a good psychologist that will give you the best treatment so far, and as well recommend you to the best place to go and receive your treatment. Because we are not talking about the immediate recovery of the patient, we're talking about the after effects of whatever is being used on that patient. So, but at this point, I'm trying to tell you that we are done with the use of drugs in psychiatry. The next topic we discuss on the other methods, that of electroconvulsive therapy, or surgical method, or use of um, insulin, that is insulin therapy. I will still discuss them one after the other as we proceed in this video. Just follow up, and I'll give you the best of your kind. I remain your resource person, Comrade Don Wokike. Please make sure you always subscribe, so that you will see most of my videos, and when they drop, and once I drop video, it will just notify you and you watch. So you can still ask questions in the comment section for clarity. You can still suggest area of discussion that you want me to talk. I'm ready to provide it for you. Listen and always further your research. Be contemplative in your study. Not all I say you take in. Go and reason. Go and study about it. That is where contemplatism come about. That's where the term contemplative come about. Always be that inquisitive and philosophical. Once you see a video in any YouTube channel at all, not only my own, but that will guide you. But don't criticize. Don't be a critical learner. Be a good listener, and use every knowledge, because in every nonsense there is science in it. Thank you as you listen. God bless you.